right, 4 minutes after 9 o'clock. Thank you for tuning in. The more time goes by, the more we figure out this thing we call ourselves, right?
Exactly.
One of the things that is almost miraculous is when you hear about somebody who hasn't been able to move their arms or their legs, and then suddenly they are able to. Dr. Ryan Uitti is on the phone. He's a neurologist, a professor. He's an expert on Parkinson's disease and other movement disorders, and he is the medical director of the Mayo Clinic Center for the Science of Healthcare Delivery. He's talking to us about deep brain stimulation and other advancements to treat movement disorders. Well, when you hear just the name, you think you automatically know what it means, right?
Exactly.
I bet I don't. Dr. Ryan Uitti, good morning, sir. How are you?
Good morning. Very good, thanks.
Thank you for calling in. Where are you? Where are you calling from?
Jacksonville, Florida, at the Mayo Clinic.
Oh, not too far away. So when we say deep brain stimulation, we're picturing some kind of way to almost massage the brain itself. Is that anywhere near close?
Well, it's pretty close. We're essentially delivering a small amount of electrical current into the brain, trying to influence some of the circuits that may not be working quite right.
Can we understand it if we know how electricity sort of behaves? Does it do the same thing?
Well, the electrical circuits within the brain function usually in a way that we never even think about, but we can essentially electrically jam or at least influence those circuits to improve the situation for patients who perhaps have uncontrollable shaking or are very slow and stiff, say in Parkinson's disease.
So does the patient have to wear something so that that electric signal continues to flow, or is it a dose of electricity and then they're good to go?
Well, actually, we have to put a small wire into the brain. So it's an invasive procedure that's kind of exciting on the day that it's performed. We put some local anesthetic into the scalp, make an incision, drill a hole through the skull, and actually the patient's awake during all of this.
Oh, my gosh.
Fortunately, our skulls and the brain don't feel any pain. So once we have a hole that's about the size of a dime on the skull, we can place a small wire that the tip of it's 1.3 millimeters, so it's about twice the size of the ballpoint pen tip. Anyway, we put that electrode into the brain such that the tip of it is about ear level deep. Once it's in that location, we can hook it up to a little bit of electrical current, and the patient who's awake may have the problem that brought them there. We can turn on the power and we can see, are we able to influence those troubles? If we are, we're just going to leave the electrode right there. We place it by fixing it to the skull with a little manhole cover, essentially, on top of the skull, and then we can put the person off to sleep. We're going to leave that electrode in place, and we have to hook it up to a power source or battery. So we make an incision underneath the collarbone, put essentially a battery that looks like a pacemaker there, and then route a wire from that location up underneath the skin and the neck up to the electrode that's going into the brain.
Wow.
So eventually everything is underground, so to speak, but it's in place, and we can send current from the battery site into the brain. Not enough to hurt the brain, but enough to influence those circuits and hopefully improve the person's quality of life in the process.
That does sound miraculous. Can you tell me, what kinds of things might a patient be in there for? Is it the inability to move an arm, or is the uncontrollable shaking that we are familiar with Parkinson's?
It could be both of those things. Lots of patients with Parkinson's are really slow and stiff. They may have tremors, and there are other even more common conditions like essential tremor, which would be 5 to 10 times more common than Parkinson's. That would be a good indication for deep brain stimulation. We do the surgery essentially if medications have not proven to be successful enough for a person.
Will this happen? Will this help the people that have Tourette's syndrome?
It can be used in Tourette's syndrome in a similar circumstance if medications don't do enough good.
Okay, so this might be dumb. I don't know, but do you keep them awake while you're doing all this and then you put them to sleep, I guess, for the healing part of it? Are they awake because you want to kind of move the little thing around a little bit to see if it needs to be in a better position?
That is certainly a possibility. They have to be awake so that we can see if it's working. If a person's asleep, they're not going to be shaking, they're not going to be slow, they're not going to be stiff. So we test it out while they're awake, and if necessary, we may have to move the tip of the electrode by several millimeters, which is essentially miles within the brain. We want to make certain it's in a good spot, a spot that's not causing some other side effects, but only delivering good benefit.
So you stay away from the brain stem itself?
Do we stay away from the brainstem? Yes.
Yes. And when the patient has this procedure, when the wire comes down and is hooked up to something, do they have some kind of mechanical device themselves where they can stimulate themselves, or is this all automatic?
We program the pulse generator, which pretty much looks like a pacemaker, so that they don't have to adjust it. But we do give them some control. They can either turn the device on or off, or make some very mild adjustments with the voltage. But otherwise, the device is usually left on constantly because you want to usually treat these symptoms consistently. So day and night, it's treated.
Wow. Do you foresee that this kind of procedure will be used for other things that we can't even, or we can only imagine? How about I put it that way? Things like autism and other brain issues that we've always thought are just permanent and there's nothing you can do about them. Is it possible that we will be able to do something about some of those things?
I think it's very conceivable that deep brain stimulation will be used for multiple indications. There are some patients who have had this used for treatment of depression or even for weight loss, because you're influencing different circuits that influence different behaviors.
And how about dementia? Will that restore a person's memory?
We have not seen a restoration in dementia, but there is some work being done at Mayo and elsewhere where we've put electrodes in locations that we hope will lead to less loss of nerve cells and less of a chance of dementia. So there's certainly a lot of research yet to be done, but this device that's really been around just a little over 20 years has come a long way in providing tremendous improvements in quality of life for a lot of patients.
Okay, one more kind of far-reaching question, and then we'll go back to the main point of the call today. The Mayo Clinic is famous for helping people with cancer, and some reports indicate that cancer might be helped or fixed with a better immune system. Would this help that? Could this help energize an immune system?
Well, we're not exactly certain how to influence the immune system with deep brain stimulation, but a lot of the same technology, that is delivery systems to very precisely bring treatment to different spots within the brain, may be useful.
Wow.
So we can deliver growth factors, different kinds of trophic factors, and even genes to specific locations within the brain using the same type of stereotactic or the equipment and procedures that allow very precise targeting of treatment.
And can people go swimming with this device, do some kind of physical activity, or is that limited?
No, No, the goal with deep brain stimulation is a person should be able to do just about everything they had done in the past, because the device is completely underground, underneath the surface of the skin, so people can, we've got people playing golf, playing tennis, using their arms and legs as if nothing was in place at all.
For the listener who is perhaps turning up the volume because they want to hear more about how this helps somebody with Parkinson's, what would be your advice to them? Should they call their local doctor or call the Mayo Clinic? What's the best avenue for them?
Well, I think consulting mayoclinic.org would be a good start. Otherwise, the physicians that would know about this would be neurologists, particularly neurologists known as movement disorder neurologists.
Okay, very good. Dr. Ryan Uitti, thank you for taking time to talk to us about this. You do amazing work. Thank you for the work you've chosen to do.
Oh, you're very welcome.
Thank you, Doc.
Have a good day.
We'll be right back.